in charge, making your blood vessels big and bounding, fresh off the release of her 2 new books, Be True to Your Salt and Salt Happens. She's big, she's bloated, the glamorous, the fabulous, Miss Salty Sodium! Today we're wrapping up hypernatremia. Hyper meaning high, nat meaning sodium, emia in the blood. Sodium greater than 145 microequivalents per liter. Now, sodium's function is to maintain 2 things, blood pressure and blood volume. She's regulated by ADH, the antidiuretic hormone, also known as add the H2O. It basically holds fluid in the body and influences sodium levels. Aldosterone, I call aldosterone, the security bouncer in the kidneys, holds onto sodium inside the body by blocking her at the kidney exits. And lastly, sodium is regulated by the sodium-potassium pump, which moves sodium out of the cells via active transport. Now, the main causes that keep sodium high in the body and not in the potty, using our nifty acronym, the last DIVA, L, the loss of fluids causing a thick, concentrated blood known as hemoconcentration. Fancy words for dehydration from conditions like infection, diarrhea, heat exhaustion, or even a lot of diaphoresis, which is persistent sweating where fluid loss is faster than sodium loss. Hence, sodium is concentrated and increased in the body. Now, a little NCLEX tip for you. Words like persistent, severe, or profound are late and serious signs. So please be sure to write that down. Now, diabetes insipidus dehydrates you too by causing death to ADH, that add to H2O hormone. So I call it di-ADH because fluid leaves the body quickly. Now, A stands for ADH insufficiency. Now, as said before, I'll say it again, diabetes insipidus, di-ADH, die, causes dehydration. ADH, which adds H2O to the body, is dead. So basically, fluids leave the body very quickly. S is for sodium excretion impaired, so renal failure, basically broken kidneys. T is from too much processed foods, so packaged foods, canned foods, fast foods, even fried foods. D is from deprivation of fluids from not enough fluids like drinking water, which causes high and dry lab values. Now, in fancier terms, we call it hemoconcentration, very thick blood. I is for IV hypertonic solution excess, basically too much hypertonic IV fluids, like 3 to 5% normal saline, which is a very thick, salty saline solution. Now, vitamins or sodium supplements, like medications like Alka-Seltzer or aspirin and even cough syrups, all contain high sodium. A is for aldosterone excess, like Cushing's disease, which leads to hyperaldosteronism, and we call aldosterone aldosterone, the security guard bouncer in the kidneys, which holds sodium inside the body by blocking her at the kidney doors. So, our patients are going to retain all this water and they'll look big and round like big moon faces with Cushing's disease. So what's going on in hypernatremia? Well, high sodium, right? And since sodium is the queen of blood pressure and blood volume, well then everything in the body is going to be big and bloated, right? Now, before you start memorizing all these signs and symptoms and pretty much have a whole meltdown of confusion and start reconsidering your career choice, let's make this simple and focus on what the test will ask you. And really, what do you think the test is going to ask you? Well, priority signs and symptoms, of course. So who are you going to assess first? So write this down. We're going to go from mild to severe signs and symptoms, also known as nursing assessments. So early mild signs, you'll have muscle fatigue, weakness, and faintness, kind of like how you feel before a big nursing test. Late signs, you'll have a red, swollen, dry tongue. Huge NCLEX tip, by the way. Write that down. Confusion, irritability, restlessness, hyperreflexia, basically means increased deep tendon reflexes. Thirst, muscle twitching, and even edema. Kind of like how you feel during a nursing test, right? Now, severe signs, nausea, vomiting, increased muscle tone, huge NCLEX tip, by the way, write that down. Seizures and coma. Kind of like how you feel after a test waiting for your results. Oh, what did I get? What did I get? Okay, maybe not the seizures part, but definitely that intense increased muscle tone. And maybe that like nausea, vomiting, because you're waiting for your results to see if it passed or not. Okay, now that we went over our top priority signs and symptoms, let's go over our other signs. So again, the body's going to be big and bloated. So the heart will be big and bloated most of the times. Now the vital signs, you'll have big bloated blood pressure, also called hypertension, big bounding pulses, and now since hypernatremia can also be caused by dehydration, you could have a reverse of that as well. So the heart rate, you'll have tachycardia if the body has low fluids, and since the body's trying to compensate, the heart rate will be going faster. Now, EKGs, you'll have cardiac dysrhythmias. Now, next to the lungs, you'll have a big bloated diaphragm leading to shortness of breath, also called SOB. What'd you call me? Now, crackles too from the fluid volume overload clogging up the lungs. Now, the neurological system will be big and bloated, Just think, guys, you have thick and salty CSF, cerebral spinal fluid, that sits around the brain and spinal cord, and it will cause all those brain cells to shrink, basically drawing fluid out of those cells and into that surrounding CSF. So once again, guys, early mild signs are muscle fatigue and weakness. Late signs are confusion, irritability, restlessness, that hyperreflexia, increased deep tendon reflexes. And these late signs, severe nausea, vomiting, increased muscle tone, seizures, and coma. Very serious. Now, GI and GU, or urinary, will be big and bloated. So GI, nausea, vomiting, remember that's a severe sign, as well as decreased urinary output, because all that water is retained as long as sodium is retained in the body. You're going to have really dark and smelly, high specific gravity over 1.02 urine. Now, musculoskeletal is going to be big and bloated, so muscle twitching, cramps, and just like we said before, increased deep tendon reflexes known as hyperreflexia. Now, the intag, big and bloated, kind of like a waterbed. So the skin's going to be big and bloated, known as edema, which is big, puffy skin and kind of looks like that waterbed. Now, pitting edema looks kind of like memory foam when you push it. You'll also have dry mouth and dry mucous membranes, a red, swollen, dry tongue. Please make sure to write that down, big NCLEX tip. As well as the color will be skin and flushed, red and rosy, kind of like Santa Claus, who's also big and bloated. Lastly, warm skin, you'll have a low-grade fever, because let's face it, sodium is an electrolyte that lights up the body, makes your body very actively electrically. Okay, so now that we know our signs and symptoms, what are we going to do about it? Here are some nursing interventions for high sodium hypernatremia. So using our nifty acronym MAGIC, now for M, we're going to monitor severe signs like coma and seizure or increased muscle tone. Please make sure to write that down, big NCLEX tip, as well as red, swollen, dry tongue. A, we want to avoid decreasing sodium too quickly. It can cause swelling in the brain due to rapid fluid shifts. Also avoid anything that comes in a package like canned foods, packaged meats and cheeses, and even ketchup. Oh, what do you mean this? Avoid cold medicines or other sodium-filled substances like Alka-Seltzer, aspirin, and even cough syrups. G is for our gravity of urine, so monitor urine-specific gravity over that 1.020. Very thick and dark urine. I is for I's and O's, so monitor your I's and O's. C is for your cardiac monitoring for dysrhythmias. Now, just in case you missed it, caution, do not decrease sodium too quickly because it can cause brain swelling due to rapid fluid shifts in the brain cells. So we're going to use isotonic 0.9% normal saline or hypotonic solutions that half NS or 0.45% NS. We're going to give it very slowly so we can protect the brain. All right, guys, that wraps up our lesson here. We'll see you in the next video.